Welcome to the first in a series of 3 short videos from COSRH looking at emergency contraception. In this first video, we will be discussing how to assess pregnancy risk after unprotected sexual intercourse has occurred. This is important as it enables you to work out how likely it is that a pregnancy will occur, which will enable you to provide the most appropriate management. In order for pregnancy to occur, we require 2 things: a sperm and an egg, and these must meet in the genital tract while both are still viable in order that fertilization can occur. Sperm will survive up to 5 days in the genital tract, but the ovum is only capable of being fertilized for about 24 hours after ovulation. To assess the pregnancy risk, you need to know: first, the exact date of the first day of the last menstrual period. Second, the earliest predicted date of ovulation. And third, the exact dates and times of all episodes of unprotected sexual intercourse since the start of the last period. So when does ovulation occur? This will vary with the length of the menstrual cycle. We measure the length of the menstrual cycle from the first day of one period to the first day of the next one. The day that bleeding starts is considered day 1 of the cycle. Many people do not have completely consistent cycle lengths, so you need to ask what is the longest and the shortest cycle length in the last 6 months. Ovulation occurs 14 days before the next period is due. We are interested in the earliest possible date of ovulation, so we use the shortest cycle length. So, if your patient has a 26 to 30-day cycle, the earliest predicted ovulation will occur on the shortest cycle length minus 14 days. The shortest cycle is 26 days, so the earliest predicted ovulation is 26 days minus 14, which will be on day 12 of the cycle. Let's work through some other examples. If your patient has a cycle of 25 to 30 days, the earliest likely ovulation will be on day 25 minus 14, which will be day 11 of the cycle. If the cycle is 28 to 35 days long, the earliest likely ovulation will be on day 28 minus 14, which is day 14 of the cycle. We now need to work out the pregnancy risk. We know that sperm can survive for up to 5 days in the genital tract, and that the ovum can only survive for 1 day after ovulation, so that we can now see these are the 6 days that carry the greatest risk of pregnancy. So, for our patient with a 26 to 30-day cycle, the earliest date of ovulation is day 12. Risk of pregnancy is highest after unprotected sexual intercourse that takes place during the 6 days leading up to and including the day of ovulation. Thus, the days at highest risk are day 7 to day 12 of the cycle. However, if our patient has a longer 30-day cycle this month, she may not ovulate until day 16, so she could be at risk from day 7 to day 16. Although pregnancy is very unlikely in the first few days of each cycle and also just before the next period is due, we do not take any risks and will always offer treatment to anyone requesting emergency contraception where there has been any risk. Always remember that episodes of unprotected sexual intercourse close to the time of ovulation will carry the greatest risk of pregnancy. The easiest way to work this all out is to draw a line on a piece of paper. Firstly, mark on the date of the last menstrual period. This is day 1 of the cycle. Then mark on where in her cycle she is today. Next, calculate the date of earliest ovulation, which is the shortest cycle length minus 14 days, and mark this on the line. You now need to find out about every episode of unprotected sexual intercourse that has occurred since her last period started, and mark them on the line. If any of these episodes fall during the 6 days leading up to and including the day of ovulation, then there is a high risk K of pregnancy. If there is a very variable cycle, then the high risk period may be longer. In the next 2 videos, we will discuss how emergency contraception works and how to select the best method for each patient.